Station 5, you're going to practice making some observations, and you're going to make observations on moles to determine whether they're normal or cancerous. So if you look at your lab task, you're going to be reading a little bit about different kinds of data, and in your reading before, you hopefully learned about qualitative and quantitative data and what the difference is. This will tell you a little bit about qualitative data. Then you're going to come over here and you're going to look at 6 different patients' moles, and you're going to decide, you're going to make some observations about them and decide whether they're cancerous and you would recommend a biopsy or not. Well, you wouldn't know they're cancerous until you did the biopsy. And the way that you can make observations is by looking at this chart, which tells you some characteristics of normal moles or cancerous moles. You can look at the symmetry, and here it's going to tell you a little bit about what symmetry means, the border, the color, the diameter, how wide it is, and evolving, whether it's changing in some way. So as you look at these different characteristics, you're going to use these to describe this patient's mole. So for example, you'll talk about the color, you'll talk about it being symmetrical, it gives you the size, and you're going to make, and you look at the color, you're going to make all those observations onto your data sheet, and then depending on whether it kind of fits the normal characteristics of a mole or cancerous, you're going to recommend a biopsy or not, and explain why you would recommend one or not. And after you do that, you're going to just answer that third question, and you'll be done with Station 5.